Now let's talk about thiazide diuretics. This is a moderately efficacious diuretics, and the mechanism of action includes thiazide blocks the electrically neutral sodium chloride co-transporter in the discombobulated tubule. It inhibits sodium chloride reabsorption from the luminal site of epithelial cells in the discombobulated tubule. This is a picture showing the mechanism of action of thiazide diuretics. Now, effects. Diuretic effects includes increased excretion of the sodium potassium chloride, so there is decrease in the plasma volume. Hypotensive effects includes decreased plasma volume, diminished responsiveness of the vascular smooth muscles to norepinephrine leading to vasodilatation and decrease in peripheral vascular resistance. Release of the prostacyclin PGI2 from vascular smooth muscle. Now, effects. Hypokalemia, alkalosis, hypercalcemia. The delivery of the increased downstream sodium load enhances the loss of the potassium and hydrogen at the level of the collecting tubule. The calcium diffuses across the luminal membrane through the channels regulated by the parathyroid hormone and returned to the blood by sodium calcium antiporter, and inhibition of the sodium chloride co-transporter by thiazide causes decrease in the sodium inside the cell, which activates sodium calcium exchanger and leads to increase in the reabsorption of the calcium and thus causes hypercalcemia. Now, pharmacokinetics. It is orally active, it is not metabolized, and all secreted by acid secretory system in the PCT and compared to the secretion of uric acid. Indapamide is excreted primarily by bile. Now, clinical uses. For hypertension, CCF, erythematous states due to chronic and renal and hepatic failure, nephrolithiasis due to idiopathic hypercalciuria, and nephrogenic diabetics insipidus, which is ADS resistance. Now, adverse effects. Hypokalemia, hyponatremia, hypotension, hypokalemic metabolic alkalosis, impaired carbohydrate tolerance, hyperlipidemia, and hyperuricemia. Allergic reaction may occur and other toxicities like weakness, fatigability, and paresthesia. Now, contraindication. Hepatic cirrhosis, patient taking digitalis, hypercalcemia, borderline renal failure, diabetes mellitus, and gouty arthritis. Advantages of thiazide diuretics. In hypertension, it is a drug of the choice for mild to moderate case. There is no interference in the acid-base balance, and it can be used in hypercalcemia. Now, advantages of the thiazide also includes the paradoxical use, which means it is usually used with cyclooxygenase inhibitor, which is indomethacin. It decreases the effective circulatory fluid volume, which may increase the oncotic pressure of the plasma protein and decreases the hydrostatic pressure of the peritubular capillaries of the PCT. There is increased sodium and water reabsorption from the proximal collecting tubule, and there is a decreased fluid delivery to the collecting ducts, and there is decreased polyuria. Why indomethacin is given with thiazide? There is decrease in the glomerular filtration rate, increase in the fluid reabsorption from the PCT and DCT, and it potentiates the effects of the ADS on the principal cells of the collecting tubule.